limits, man. Okay, calm down.
2021, Congresswoman Pramila Jayapal from Washington introduced the Medicare for All Act of 2021, and it was based on the bill that Kay was talking about, the John Conyers bill, which he introduced in 2003. And we consider this the model bill. And Jayapal's bill was introduced in 2021, and she is due to reintroduce it or to introduce it for 2023, probably in the next few weeks or so. And while it is a really good bill, it's actually a great bill. It covers, it's universal health care for everybody. It's comprehensive care for all medically necessary care. It covers hearing, vision, dental, mental health, substance abuse, inpatient, outpatient care, prescription drug costs, medical equipment. Importantly, it guarantees a woman's right to reproductive rights, including abortion. And it will eliminate health insurance companies. It will eliminate Medicare Advantage and Medicaid, the exchanges, and most importantly, it will eliminate the possibility of ever being uninsured. But there are some things that really do need to be improved in that bill before it gets introduced. And if that's okay, I'll just go ahead and talk about the 4 points that, in fact, National Single Payer, which is an organization that Kay and I belong to, published an open letter to the co-sponsors of HR 1976, which is Jayapal's bill. First of all, thanking them for being co-sponsors, and then asking Jayapal to improve the bill before it gets introduced. And it's an open letter that was published in Common Dreams and on March 7th. So if people want to look it up, or they can go to our website as well, and they can see they can read the open letter there. But importantly, there are 4 things that really need to be improved. One is the conversion of for-profit hospitals to not-for-profit status. Amazingly, much of our healthcare system is already owned by corporations. In fact, more than 90% of skilled nursing facilities, of nursing homes, and of dialysis centers are owned by private corporations, and 10% of all hospitals are privately owned. And so what we need to do is, it would be insane really for us to have a national single payer program where we take public funds and pay corporations and pay private equity firms, right, to take care of our medical needs. So those corporations, those for-profit institutions and facilities need to be banned, but they need to be converted, right, into not-for-profit status. And the reason for that is because when you think about it, our dialysis centers, more than 95% of them are owned by 2 corporations in the United States. That's DaVita and Fresenius. And we couldn't possibly shutter all of our dialysis centers and then say, okay, well, tomorrow we're going to have Medicare for all, because, people on dialysis can't wait a week, they can't wait a day for their next dialysis. And so we need to be able to conserve these facilities, but just convert them into not-for-profit status. So that's number 1. And number 2 is we need to have a just transition for displaced workers, because the truth is that workers, some people are going to be losing their jobs as a result of the fact that we're going to have Medicare for all. They will have health insurance, but they will be out of a job. So it's important to protect them. And the Conyers bill had really strong protections for these displaced workers. Now, we figure that about 1.7 million people are going to be losing their jobs as a result of Medicare for all. And just to put it into perspective or into context, about 60 million people change their jobs in the United States every year, 20 million of which are fired from their jobs. And that comes out to about 1.7 million per month that are either changing or losing their jobs. And so, 1.7 million in the context of all the people that are losing their jobs is not very much, but it's really important for us to have workers protected if they lose their job as a result of this. And so the Conyers bill had really strong protections. It had 2 years of salary parity up to $100,000 per year, and it also had first priority in job placement and training. And the Jayapal bill is very murky on this. It's very nebulous, and it needs to be the language needs to be really strengthened. In addition, it's really important for us, when we're talking with workers about Medicare for all, that if they're going to be losing their job as a result of what we're trying to to push that they feel, that they're going to be protected in some way. The third thing is that we need to have progressive funding for this act. The Conyers bill talked about progressive funding, where people of lower income would pay lower fees, lower amounts from their salaries. And it's important that corporations and billionaires start paying their fair share, because up until now they haven't been. And so it's really important that they do that. And the Jayapal bill doesn't really talk about funding at all. So it's important to include that language in the bill. And then finally, the fourth point is that we need to have a one-year transition into Medicare for all. The Jayapal bill talks about a 2-year transition with a very, very complicated Medicare buy-in, and then a stage group inclusion, which will just kill solidarity for it. It will also skyrocket costs in that first year, which will be just ammunition for our opponents to say, oh, you see, single payer can't work because it's just too expensive. So it's important for us to show the country that we can transition over a year. And in fact, in 1965, when Medicare was signed into law, Medicare signed up 20 million seniors in 10 months using index cards. So I think we can do this. In fact, I'm positive that we could.
Wow. Maybe that's the trick. Maybe we just need index cards again. None of this high-tech stuff. Yeah.
That's right.
So, okay, we hope you're watching Pramila Jayapal. Please listen to these women, because they're actual experts in this field.